More insight from Dr. Peter Chin-Hong is a professor of medicine and infectious disease specialist at the University of California, San Francisco. Good to see you again.
Thanks for having me on, Elaine.
So, Dr. AstraZeneca could soon become the next option for people in the United States. And as we know, it's made a lot of news lately, now with its effectiveness. And everyone seems to compare the vaccines by its efficacy rates. Does it really matter, or should we just get what's available?
I think as a clinician, Elaine, I'm most concerned about people coming into the hospital at severe COVID and deaths. And all vaccines so far, Pfizer, Moderna, J&J, and AstraZeneca, do a fabulous job of preventing that most serious outcome. So I think it really doesn't matter which one you get. And the issue is really just getting as many people immunized as fast as possible.
So here in the U.S., we are seeing more vaccines become available. I know some states, including yours there in California, are loosening guidelines so more people can register. Are we starting to see an impact with the COVID numbers? Are you noticing a difference?
Yeah, definitely. In our hospital now, we're not seeing quite as many. In fact, maybe 10 times as fewer numbers of COVID cases as we were in our darkest months. But still not back to our, early pandemic levels when California was a model for the rest of the country. So, we're going down to the ground to sea level, but we're not quite there yet.
When do you think we could see a major difference? Summer, fall?
Well, it all depends on the variants, and I think that's really where we're worried, just like other parts of the country. If you look at where we have hotspots now, actually more than half the country is experiencing increasing cases. So I think it's a little bit too early to say that we're going to reach that destination because of that specter of variants. Spring break, mobility, the weather is warmer, people are tired.
Well, I want to dive into those two issues. Let's start with the variants, as you mentioned. Are we going to need additional boosters to what we're already getting? How is that being managed as far as when we're seeing something coming in from Brazil or some of these more infectious variants? How are the vaccine companies adjusting to that?
Well, all the vaccine companies are trying to address the specter variants by developing boosters in different configurations. Some of them just have a simple booster of an additional that covers an additional resistant variant. So we're really talking about South Africa and the Brazilian variant so far, because the UK B.1.1.7 and other variants like the California variant, they're covered well by the existing vaccine. So you either give it as one extra dose like a jumbo boost, or you include a new vaccine with multiple variants, kind of like what we do with the flu shot. So I think different companies are experimenting with different ways, because at the end of the day, it's not really about the variants we know about. It's the variants not yet created, because the pandemic, like in Papua New Guinea, we learned today, is surging in many parts of the world.
I want to quickly get your take. We're about out of time, but what we're seeing right now in Miami, you mentioned spring break. We are in the middle of that season right now. Are super spreaders still a concern?
Completely. And when you talk about Miami, Florida has the highest proportion of B.1.1.7 variants in the country. So, that's going to be much less forgiving in terms of transmission. And this group of spring breakers have not been vaccinated yet.
All right. Dr. Peter Chin-Hong, always great to get your take. Thank you so much for joining us.
Thank you, Elaine.